just want to thank you for letting me come to your station and talk to your audience. And anytime you want me to come back, I'm there.
Absolutely. Thank you, Ara.
Thank you.
All right. We're going to not completely change topics today. We're still going to be talking about healthcare and emergency. And in just a moment, we're going to be talking about a phone service 211. And thank you, Ara, so much. Which I have to admit, I really don't know what 211 is. And maybe you do. I don't know. So we are waiting for, I believe, Jennifer Lake. There she is. Good morning, Jennifer.
Good morning. How are you today?
All right. I'm not hearing you.
Can you hear me now?
Leanne, are you there? Jennifer, say hi again.
Hi. Can you hear me? Uh-oh.
Okay. Are you muted?
Nope.
Not muted.
Let's see, maybe I can.
Okay, Leanne. I don't know why I'm not getting her.
Uh-oh.
Leanne is our ghost in the background here who does an amazing job from her home, making sure, particularly now when we have a long distance guest. Yes, the pot is up. She's like, pot up. The pot is up, Leanne, honestly. So anyway, we're going to be talking about, as I say, the 211 service. And while we're waiting, as I said, I'm not so sure about the 211 service. Jennifer, try again.
Can you hear me now?
Yay!
Yay.
There you are. Thank you. Whatever happened, hooray. Oh, hey, get that out of her face. I'm sorry.
It was so nice to meet you. I am just really happy to be here. And thank you for giving me the opportunity just to talk with you and have a conversation about 211 in Mendocino.
Absolutely. Well, I'm just going to let you get started because I have no idea what it means.
Well, you wouldn't be the only person because I've been up there doing some outreach activities with the Adventist medical centers, back to school days, and we were up there passing out information about 211, and a lot of people haven't used it or don't know what 211 is. So 211 is an easy to remember number that is nationwide. It's part of a broader network of 211s. There are, I believe it's 97 counties in California, or 97% of California cities have 211 information and referral line. And what it is what 211 does is it provides an easy to remember number for your members of your community, all throughout your county, and that provides local resources. So they're resources that are local to your communities. And let's see, 211 will serve people of all income levels, languages, cultural backgrounds. It's a critical resource during disaster times because what we do is we support 911 systems by taking the calls that are non-emergency, when a disaster happens. So I feel like really nervous. I don't know why.
No. It's okay. It's just you and me.
I know. Normally I'm not this nervous. I'm like, what's going on? So I am very new to United Way of Wine Country as the new Community Impact 211 director. And I've been here 110 days on the job. And I've got to spend a lot of time in Mendocino to meet people, working with the steering committee, public health and social services, and other people from other departments of the county. And now I'm trying to get out into your communities and meet people, so I do that by doing tabling events for back to schools. I've gone to some events. I'm going to go to one tomorrow in Covelo, where I can just talk to people. I would talk to everybody I can about 211 and why 211 Mendocino is a very valuable resource to your community. 211's been around for a very long time, since it's been around a long time, but the CPUC, which is, I know you know what the CPUC is, but designated 211 as a information and referral line only just in 2000.
Wow.
And yeah, But 211 has been around in our country since, I want to say, 1940, and it started in Atlanta, Georgia, from a group of a gentleman who was a social worker and serving, clients during a very difficult time, the depression, and just all the depression stuff, the wars were happening, and he couldn't get any information for these clients. He would go to 15 different places, call this person, go there. And so he started 211 in that area to have a single point of entry where people could call and get the information they needed to meet the need that they were calling. People who call 211 are calling because they have a specific need. And generally the top callers right now in our day, the top callers are for housing, food, and healthcare. Those are the top three. And they alternate who gets the top number, but right now it's been healthcare and housing are kind of connecting that for number one.
So for example, if I was new to the area, or if I was in crises, hopefully not in crises, and I said, I really need to find some housing for myself and my two children and our dog or something, then someone, and who is that someone who answers those questions?
So yes, you would call you could call 211. It doesn't have to be a crisis. Your crisis.
Oh, okay.
Yeah. If you need a resource, local resource like that, like you don't know where to go to seek out to find a house, you would call 211. And 211 is a national number, so that you can call and get information. So what happens is they split up into little 211s all throughout the country. And so in California, your Mendocino, 211 Mendocino, has a call center based in Ventura, and it's the 211 call center. So what happens is you would call 211 to get housing support, and a call specialist who's highly trained on your local resources, and they work with a 211 administrator, which is what United Way of the Wine Country is. We are the 211 administrator right now in this area closest to you. And so we help Mendocino County folks, steering committee, vet the information, get all the resources uploaded into the database, which is one task. And then that database houses all your local resources. And our job would be to keep it, the administrator's job would be to keep it updated, because it's resources and they change and people move. And so if you were looking for housing, you would speak to a call specialist who would then ask you some questions so that they can meet your specific needs. So they'll ask you location and what kind of house, what kind of services you need, maybe income information. And from that, they pull, with keywords, they pull your housing resource data out of the database local to your area. And so, but that's not all they do. Once they do that, they go through each of the resources that they pulled up for you, so that you can choose which one fits your needs. It's as opposed to the old school way where we would call and they give you a number and you would hang up and go call them yourself and maybe get a hold of them. They make sure that you get the appropriate resource the first time. And so I personally, being new, have only been here for 110 days. I worked for a housing program prior to this, and I have been doing case management, social work in the nonprofit sector for 30 years, my whole career. And I've worked with a lot of people for housing and resources and all of this stuff. And I never called 211. I knew about it, but I never called 211. And 2 months before I got this job, I was working with somebody getting evicted for smoking. I called and I couldn't find anybody to come do some classes. And so I called 211, and I had the best experience I've ever had calling any kind of resource line. They kept me on the phone long enough to walk me through the resources they could find. I found the perfect resource for this person that I was working with. And on top of that, when we were done, they text me those phone numbers that they had just given me so that I had them, and I thought, as a service provider all those years, had I known I could do that, get that much done in one 20-minute phone call for this client, with resources, I would have had it on speed dial. And I don't think that the community of service providers who work with our vulnerable population realize that it could make their life easier just using 211. They're not necessarily calling for themselves, but for somebody else. And that's what it's for. It's to help guide you to the appropriate resources. And it's very, I mean, I can give you some data.
Okay, well, hang on just a second. Let me remind people, you're listening to Jennifer Lake from Mendocino County Health, and she is now a specialist in dialing 211. And I have to admit, as I admitted it when we started talking, I had no idea what 211 is. We know what 411 is, and then there's a 611, I believe, which I can't remember what that is either.
Information for phone repair. Do you know what 811 is?
No.
811 is if you're going to do some construction and you're going to dig in the ground, you call that number to clear it for pipes.
That's right. That's right. So, so now, along with all of your listeners, we're learning with Jennifer Lake about this 211 service, and what other kinds of things? I mean, is it as simple as saying where is a pharmacy, or where could I get COVID shots, or that kind of thing?
Well, the call center employs call specialists that are bilingual, Spanish speaking and English speaking, 24 hours a day, 7 days a week. So you can always call. If you're in a crisis in the middle of the night, you can call. No matter what, you're going to get that service. They also offer translation services in, I think, over 140 languages.
Oh my goodness.
That is not a barrier to calling for help. The other pieces to that is when you call, the call center also offers a little bit of direct service, So if you are a person who is caring for your family member, like they're suddenly disabled or they're aging, and you're caring for them, and you're not paid, you're just a family taking care of your family. They have a program called caregiver coordination, and the caregiver coordination is for people who need extra support who aren't necessarily caregivers. And so that's a new thing that they started doing before I got here, maybe a year ago or so, a pilot program. And it's like there's no other resource I know of where you can call as a family member taking care of your family to get, therapy support and also every resource and information, a referral, or even the direct service programs are free of charge. We provide resources that are free. We don't let's see what else. I'm forgetting something.
We don't get charged for 211.
No, you don't get charged. Your county of Mendocino supports 211 through by subcontracting with United Way of Wine Country to be your administrator. So we do all that work that I'm kind of referring to. We do all of that on our end, so that up in Mendocino County and all of your cities and communities, we can go out and do outreach and reintroduce the 211 resource to people. Because I mean, you'd be surprised how many people don't know about 211, or they knew that we had it, but it didn't work or something, so we're not sure. I mean, those are the answers that I'm getting. So we're out there, we're doing outreach. We work with public health. There's a steering committee that is facilitated, as you know, through public health and the Department of Human Services. And because I'm so new, I can't possibly tell you who else is around the table, but there's a few people from the county, like First Five, and I'm not sure about anybody else. So who have been really, really instrumental in connecting us to people in Mendocino that we should be talking to decision makers, to you. Our goal, the United Way's goals, our goal is to try to provide this information, provide easy access to all the members in Mendocino, including the tribal communities, working with them and providing them with, maybe a committee, just working with them to provide culturally appropriate resources, or interact with, because what the data tells us is that the tribal communities are not regularly using 211, and so we want to go get out there and say, hey, this is just a resource that you can pick and choose, and they will walk you through some things. They don't just give you a number to some, and just kind of build some trust. with the tribal community to say, well, this is just a resource for you, and it's a way for you to, meet some of the unmet needs in your communities, which, from what data tells us is, a food disparity, public health notice of food disparity, and housing concerns, and untreated medical concerns is why we brought back 211 Mendocino.
All right. So if you're living in Kashaya or up in Manchester Point Arena, you're in Pomo in the area,
Yeah.
that could be a good resource. This is a good resource. That could be because, there's got to be a starting place. And sometimes, having that starting place, a 211 call, can help you get through not through red tape, but finding the right resource for you quickly. And I am kind of amazed. I really didn't know anything about this, and thinking about the way it can help people. Prior to your interview this morning, we had Ara Chakrabarty, who's the head of our local Redwood Coast Medical Services here, and who we have on regularly. But again, we live in a very rural area. I'm not sure if you've been out our way, but off of Highway 1, and we are our towns and communities, a couple are close together, but a lot of them are separate. During the winters when there's flooding, roads are out, all kinds of things can happen. So we all know about 911,
right,
but not 211. So 211 can also help you. Like you said, you don't have to be in a crisis. I guess that's the other thing I want to emphasize. This is not for crises. If you're just confused about moving to a new area,
or if you're flooded in and you can't leave your property and you're stuck, or if there's a PSPS event, which is public. You're familiar with the PSPS event?
Sure. Oh yeah, we are.
Yeah. I mean, we all are now. That's the new age,
I know.
But, right. And so we provide resources. We try to work with, and we're still building this in Mendocino County. But I have been to some. I wouldn't call them rural. I haven't done the rural yet, but I've been to Willits, and I've been over to Fort Bragg, and I'm going to be going to Covelo, which is also coastal. I understand somewhere on the coast. I mean, I literally am familiarizing myself with the landscape up there, reading all the profiles and things. But
well, you got to come out our way, and see Kashaya, the Rancheria.
I would love
it. Stewart's Point, tiny little place, Kashaya, and then there's the Sea Ranch right across the river from Sea Ranch is us, Gualala. We're at the station is at the tip of Gualala, and you go north to Point Arena, Manchester, and beyond. Then you go all the way up to Fort Bragg. So
yeah. Well, I'm looking forward to it because I've worked with people in Ukiah over the tenure of my career, and I've worked with most vulnerable populations. Longest history would be domestic violence and sexual assault, human trafficking, and so I've worked with Project Sanctuary up there. I've worked with, there's a little tiny safe house place. Can't remember the name now because it was about 10 years ago, but in Gualala, there's a place up there where they put people in safe place up there.
Good to know. So if I was in crisis, for example, and I called 211, and I'd ask, where's the safe place?
You would
tell me.
Yeah, and they would ask you questions,
Sure.
like, what's your situation? Then you'd probably disclose, domestic violence, sexual assault, or something of that nature. Then they would say, oh, you need to call this number to get to that place. And because the safe places aren't necessarily up on 211 because they're
sure.
Yeah. But the program is Project Sanctuary out of Ukiah used to be the point of contact. So, and those are the things that the call center will know. It's like, oh, well, the point of contact is Project Sanctuary in Ukiah, but they will get them to the safe place over in Gualala or the coastal cities there.
So it sounds like there's almost no question you could ask that they couldn't answer about services, correct?
Pretty much, yes. About services that meet a health or human service need, a specific, a need. But that's not to say that like yourself, you call for housing. You can call and say, I'm trying to find a dentist. You can call, it doesn't, but then what I did want to say though is disasters. The disaster periods, like what 211 offers communities is the non-emergency. So the disaster's happening all around you, but you're in an area where you're isolated and you can't get to anywhere. And you don't have any contact or like your phones don't work, everything's down. What do you do? So we in Sonoma County, we partnered with a program that does disaster preparedness presentations. I'm sure that Mendocino County has them. I'm just having to learn who they are so I can go meet them. But what is great about that is this program talks about like the hand radios and which ones work and which ones you should have, and it helps people in the rural communities be able to contact, say, I'm here, or I can't get out, or I don't have any food and I need food. And our United Way goes to their communities, regions, which would be Mendocino County and us, and provides resources for food. If there's a PSPS event and you've lost your entire freezer of food, we're going to make sure that you get some resources. We work really closely with our Department of Emergency Services here in Sonoma County, but we would like to, have a relationship with the Department of Emergency Services in Mendocino County so we can offer the same types of things. They give us access to people, work with REDCOM up there, and make sure that we're providing that support to them during a disaster.
You said works with REDCOM?
Oh, the 911.
Oh, okay.
I just learned that yesterday, that they are REDCOM. I'm thinking, I'm going to go meet people with 911. Now I'm going to go meet people at REDCOM. And she says, no, they're the same.
Okay, that's a whole new term for me, I have to admit. So, yeah, two things. 211 and REDCOM is 911, basically.
That's what I understand. No, not 211. REDCOM and 911 are... REDCOM operates 911.
REDCOM operates 911. Yeah. Hey, if you just joined us, I'm confusing Jennifer Lake.
I love this radio show.
I'm Peggy Berryhill. Nice to meet you. Well, I confuse people enough, but this is really good information because Jennifer's introducing us, or at least introducing me. Maybe you were already familiar with dialing 211. And I'm just amazed at the kind of information that you can find out that will lead you to other resources. Again, you don't have to be in crisis, but if you are, it's another place to call. Particularly, it's helpful if you're in an urban area or a rural area like ours. Jennifer, did you come from a rural area or an urban area to get your job here?
Oh, I've been in Sonoma County for 30 years. Oh, okay. My whole career is Sonoma County. My daughter moved to Hopland. She lives in Hopland. So I spend a lot of time at the very southern end of Mendocino County, but that's my only foot in the door in Mendocino County, which has been a really great experience because I come up there at least once or twice a month, and I have had lunch with the North Coast Opportunity programs to try to work with them to get some volunteers to help us with all the outreach tables and events that we want to go to. Like, I'm going to go tomorrow to an event, but there's like 2 or 3 more. That frees up my manager to go to board of supervisors or city council meetings to say, hey, we're here. We really want you guys to know that 211 is a great resource, and here's the 14 reasons why, and so we need some support to do that because we're just one person, and you have a pretty big spread out county, like you said. So, we get up just to go to Fort Bragg to their back to school days with the Adventist Health Center up there. I had to spend the night in Fort Bragg, which wasn't a hardship for me at all, but I had to spend the night there with my husband. And then we went and we did the tabling the next day because it's like almost 142, it's 200 something miles for me to go here from where I live in Petaluma to there. And so that's the challenges that we're kind of navigating. Like, well, how do we really do this if we don't live there? And we have the opening right now because Yesenia has decided to move on. So we're looking to hire another community impact manager. And I'm like asking, can we hire a person who lives in Mendocino? Everything is Zoom, and they would have to come do outreaches. So it'd be interesting if we get to do that. I think that would be the perfect answer.
Okay, so Jennifer, your department is looking for someone as well. How do people find that information out?
You can find that information.
Call 211.
Yeah, call 211. No, actually, they all know we're looking. So if I would, you could actually call myself, or you could call, you can go on our website, United Way website, United Way Wine Country, of the Wine Country website, or Indeed. That's where I saw it. My job was on Indeed.
Indeed.
Indeed, the job board.
You're just educating me here. That's the third thing I don't know anything about. Maybe our listeners do. That's where for job hunters.
Sure, like like monster.com and
yeah,
those are all job search engines. And so you can, if you get email and you look for a job, or you apply for a job through your email one time, you're going to get flooded with them. And then these are the job boards. But you can definitely call me at my number, and or email me.
And what is that number?
My number is 707-284-7085. And my email is jennifer.lake@unitedwaywinecountry.org.
Wow, that's one word, United Way Wine Country.
Yeah, it took a minute to get to type that one out for sure.
UnitedWayWineCountry.org, and it's Jennifer at
Jennifer.lake.
Jennifer.lake. Just like it sounds, lake.
Yeah. And I'll put it in. I could put it in the chat too.
Great. Why don't you do that? And we just have a couple of minutes left here. So what else do we need to emphasize about using this service called 211 on your phone?
Yeah. Well, so I also miss key points because it's a conversation, but so there's 3 ways that you can get access to 211 database, and that would be making a phone call to 211. You can text and text with a live person as well, and that would be, oh Lord, oh I have it right here. Forget my own. Okay, that would be that's not it. I'm trying to remember. It's 988. I don't want to give you the wrong number. You can get help at 211sonoma.org. Mendocino.org, or you can call 211, or you can text 988-211.
That's all, 988-211.
Yeah, that's, you text that number in, and then it gives you, prompts you to you get online that way, and then that somebody will respond to you. And I think it's automated first response, and then when you start asking questions, then you can get a live person.
Okay, so we're not actually phoning, we're texting a internet something.
That's a choice. You have 3 choices. You can text, you can call, or you can go online and surf around on the website yourself and find your own resources. You can do that as well.
Okay. Well,
I'm encouraging people though to call 211, because that's the personal experience you'll get with people who are trained and able to walk you through the resources that are available in your community.
Jennifer, we're just about out of time. You got about 15 seconds. What are you going to share with us? Well, we don't want to just cut you off. And
you know what? I just appreciate your giving me the opportunity to come on here and do this. Get my name out there in the community, because I'm going to start knocking on people's doors and introducing myself, and that's very helpful if they know you're coming.
All right. Jennifer Lake is heading our way, folks, with the 211 service from United Way. This is a great pleasure. I learned a lot from this today, too. And did we get your phone number, Jennifer? Because I got to run.
I'm putting it in the chat right now.
Okay. Well, I got to run. I got to go to Albuquerque right now. So next show.
Okay.
Last 10 seconds. I've got you 10 seconds.
You got it.
And she is typing at us. All right. Well, we're
going
to
hurry because I got 30 seconds. It's a test.
Up. You're getting down there. So
there you go.
Okay, there we go. 707-284-7085. Jennifer Lake. That's got to be it. I got to run down to the next show in Albuquerque, New Mexico.